And the Kenyan Doctors Union representatives are expected to resume negotiations this afternoon with the government over demands to end the ongoing strike. This comes as nurses trickle back to work, although, as Timothy Otieno tells us, patients are not rushing back to public hospitals just yet. So let's now join Timothy, who's in Dagoretti, for more on what is happening in the hospitals. Timothy?
Well, thank you, Sophia. I'm at the Dagoretti Sub-County Hospital here in Nairobi. Nurses have resumed duties, but there are not as many patients as perhaps it would have been anticipated. As you can see, I'm actually at the maternity wing of this hospital. A lot of empty beds, but of course the personnel here have since resumed duties following that signing of the recognition agreement by the Nurses Union and the government 2 days ago. But of course, I'm joined by the senior nursing officer in charge at this particular hospital, who of course is going to be updating us on some of the measures that they are taking and what kind of treatment they are giving to the people here. So thank you so much for joining KTN News. You could begin by telling us your name and so far since work resumed, how has it been?
My name is Consolata Dege. As he has said, I'm the nursing officer in charge of the hospital. Our nurses came back on duty, all of them yesterday, following the agreement signed by the union and the government. And so far, we have started seeing the patients. Though the flow is still quite low, but the patients are being served. Both curative and preventive services are going on. We are offering the maternal and neonatal child health care services. We are offering the immunization services. We are also providing the curative consultations, the outpatient consultation services is ongoing. And in maternity, we are also admitting and providing care of normal deliveries. However, we are still not admitting complicated cases because our doctors are still not back on duty. We are still waiting for them to come back.
When you say you're not admitting complicated cases, which are some of these examples of cases that you cannot handle because it's well above perhaps your expertise?
We can, for example, in maternity, we cannot admit a mother who has had a previous cesarean section because it's a mother who is bound to get another cesarean section, and we will require the review of a doctor to make that decision. We may also not admit a mother whose baby has an abnormal eye, for example, transverse lie, because again, this baby mother will also require a cesarean section. Those are the kind of patients that we cannot admit. But for the clients with normal delivery, we are admitting and monitoring. In case of anything, in case we realize that the labor is not progressing as expected, then we are forced to refer them earlier to avoid any complications. Yeah.
All right. Thank you so much, Consolata. That is the nurse in charge in this particular hospital. As you can see, the nurses have since resumed their duties. But if my colleague Nebat Saisi could help me just walk around this particular wing to see if we could try and get someone who we could talk to in regards to perhaps a patient. I can see there is one here, of course, who is being attended to by a nurse just right behind us there. Perhaps if you could just tell us your name and perhaps what time did you arrive here and did you get services going on?
My name is Grace Wanchiko Nyakinywa. I came here in the morning at 9 and I found doctors and nurses. They are all here and I was attended to, and now I'm just waiting for my labor.
Okay, you're about to deliver? How fast, how efficient were the services? Did you have to wait in line for a long time or they were really fast?
There was no line and it was about like two patients here and I was like the third one, and there was only one who just delivered like 30 minutes ago. So I think I'm also almost.
Thank you so much, Grace. We don't want to take too much of your time. Of course, Sophia, as you can see, services have resumed. But of course, as we've been told by the nurse in charge here, that not all services, and not all cases they can handle. There are some that still needs a doctor's expertise, but as you can imagine, the doctors are still on strike. But the nurses are holding foot are helping out as much as they can in this particular situation so far, Sophia.
Good job, Timothy, giving us a feel of what is happening in that particular hospital. Talk to us also, if you may, about the doctors' meeting that is scheduled later on today. Of course, they're still on strike with officials from the government, because the last we heard is that the government agencies were saying that those on the negotiating table were not recognized, and so they needed to have more officials that were recognized under the law. How do we know if that has happened?
Well, from where I stand, Sophia, I cannot authoritatively say what is happening at the Ministry of Labour as it is. But of course, you can imagine, as you have mentioned, the talks have been collapsing in regards to the doctor's side, and there's been no headway in that regard. Of course, we almost saw something similar happen to the nurses, but finally, 2 days ago, a deal was struck, and perhaps the ministry and the government is working overtime to ensure that the nurses, rather the doctors' deal can be considered and they can reach some sort of a consensus so that there's full operation of medical services within the country. As it stands, the nurses are just like half of the labor, and of course they'll need to work closely with their counterparts, and of course those are the doctors and the consultants who they work hand in hand and work in tandem to ensure smooth and efficiency in these operations. So as it stands, the doctors are yet to come up with a deal in regards to their pay dispute, but as you have heard the senior nurse here mention that there are some cases of that they may not be able to handle. We've just spoken to Grace, who's actually going through labor and is about to deliver shortly. There's some cases that in case if there are complications in that regard, a doctor will be needed. And if that cannot happen, then perhaps the nurses going back to work may not really be of full benefit to the Kenyans. And perhaps the talks that are going to be taking place this afternoon, if there could be light at the end of the tunnel, it would go a long way in alleviating the pain and suffering that Kenyans have had to undergo over the last 2 weeks, Sophia.
All right, thank you very much, our Timothy Otieno, for us on the healthcare crisis. Although the nurses are back to work, we're seeing that patients are yet to trickle in as fast as one would expect. Of course, the doctors still in talks with government agencies on a return to work formula. Let's